Hi everyone, it's Dr. Horzempa, and I wanted to talk to you today about a study that caught my eye in the Journal of Clinical Lipidology. It was a study called Cardiovascular Disease Risk Factor Response to a Type 2 Diabetes Care Model, including nutritional ketosis at 1 year. So this was done by a group named Virta Health, which is using the ketogenic diet to treat type 2 diabetes specifically. And what they did is they measured a bunch of labs and other things like blood pressure, which we know are associated with heart disease risk. And so they measured these things over the past year with this cohort of patients who were on the ketogenic diet. So, and what they found, first let's start with, well, what got worse, if anything? Well, one thing got slightly worse, and that was the LDL-C. And this is the number that people, when somebody talks about their LDL, they're usually talking about the LDL-C. And this is the number that, although it's not a perfect test, it is common and it is usually, ordered by most cardiologists and most primary care physicians. Although it's common, though, it's not the best test to really look at cardiovascular disease. And thankfully, the group at Virta did some additional tests. They did an LDL-P and an ApoB, which looks actually at the actual amount of LDL particles. The more LDL particles, the more likely one of them is to smash into a blood vessel wall and cause a problem, or get stuck in what we call the endothelium, the space between the cells of lining blood vessels. But regardless, the LDL-C did go up a bit. But the reason it went up a bit is because it turns out not all LDL particles are the same size. There's big ones and there's small ones. And the small ones actually are more dangerous because, again, they can get stuck in a blood vessel wall a lot easier. And what happened is the small LDL-P actually went down quite a bit in these patients. And so the large LDL particles went up, and it basically caused that LDL-C to falsely look worse. But again, there was no change in the LDL-P or the ApoB, and there were significant reductions in things like the triglyceride to HDL ratio, in the high sensitivity CRP, which is a marker of inflammation, in blood pressure in these patients, in the hemoglobin A1C, in their white blood cell counts, which again is a marker of inflammation. And the other thing which they did, which was great, is they used a validated risk score, cardiovascular risk score, called the ASCVD. And the way this works is you plug in a bunch of these numbers. So you plug in lab values, you plug in blood pressure, smoking, things like that, and it gives you a risk over the next 10 years of developing heart disease. And in these patients, that risk went down by about 12%, which is pretty amazing, actually. When you look at, that is better than most statin drugs will do. So it's overall very encouraging that the ketogenic diet was able to reduce so many cardiovascular disease risk factors. And again, the LDL-C did go up, but we do know that that's because the LDL particles became larger and became more benign as a result of being larger. So it's really good to see these studies coming out because the question always comes up among my patients and when I give talks on the ketogenic diet, is this good for my heart? And this study and studies, hopefully this will pave the way for more of these studies, will start to answer this question. But again, based on looking at this data, it looks really good, and it looks as though the ketogenic diet is actually significantly reducing most cardiovascular disease risk factors. So I hope this has been helpful, and I hope everyone has a great day. Bye.